This is the May 25th meeting of the Town of Littleton Board of Health. It's 7 o'clock. We'll get started with the 7 p.m. public hearing that's been continued, which is a variance request for 22 Woodland Drive. The applicant is seeking local upgrade approvals, approval of reduction to groundwater, and a variance to Littleton Board of Health Regulation 27. I believe Nick from GPR is here.
Good evening. Sorry about that. I was just rejoining.
Oh, you're good. Excuse
me. As you mentioned, we were before you the last meeting with a proposed system at 22 Woodland. Since then, we've provided revised sketch and revised relief request waiver. I can share my screen if you don't have that plan with you.
I don't have the plan, but I have the updated variance request. Why don't you go ahead and share?
Would you like me to share the plan? I'm sorry.
Yes, please.
So the sketch that we provided, everyone can see that, was just an 11 by 17 showing the leaching area size.
Yep. So
the system or the proposed changes that we did was looking at the site and looking at the grading. We actually elevated the system 1 foot, so it had a 3 foot offset rather than the 2 we originally proposed. So the system, as far as you're looking at it, is still the same standard 2-compartment septic tank, dosing chamber, and the same size leaching area using the Presby, but just 1 foot higher out of the ground. The other revision that we did is we actually proposed a hybrid foundation. So we'll actually have a crawl space all within anywhere that's within 10 feet of the leaching area. So we feel that these two revisions address a lot of the concerns of the board from our last meeting. What we're hoping for tonight, since it's not a full revised plan, is that the board take action on the requested waivers. So as we continue through the process with the Conservation Commission, once that plan is to a point that they're happy that they issue an order of conditions, we'll provide the final revised septic plan to Jim, in which he can issue the permit on.
Jim, do you have comments on this?
So I've taken a look at the revisions that Nick has provided, and certainly it's better from the perspective of it's a foot higher, so now you have another foot of soil for treatment. And you do have two essentially foundation walls, if you will, so they can probably both be waterproofed along with the barrier on the outside. So again, a much better situation. I should say that in all the years I've been doing this, I've never, that I can think of, have had a case where it has migrated from the system to the house. But that's a pretty bad situation to have, and I don't know how you address it. So again, the concern, with the double walls, the barrier, and it being a foot higher, I think they've mitigated a lot of that concern.
Kevin Davis, any questions, comments?
I have no questions or comments for this. No, this looks good.
Dan Kane?
Dan Kane has no comments.
Nick, I'd just like to say I appreciate the revisions. I think you did a great job working with what you have here, and I think this is the best you could possibly do. So thank you for that. Thanks for working with us, and thanks for your patience, and thank the owner for their patience too.
Appreciate that.
We'll entertain a motion.
I'll make a motion that we grant the waiver requests as described in the request letter dated May 24th from GPR Civil Engineering.
I'll second that motion. We'll do a roll call vote. Kevin Davis?
Kevin Davis says aye.
Dan Kane?
Dan Kane, aye.
And Kevin Baker says yes. Thank you. Thanks, Nick.
Thank you very much. Enjoy the rest of your evening.
You too. So we have a 7:10 p.m. public hearing for 9 Wellington Drive. We'll have to wait. I don't know, Jim, if you know if they're coming or not. They didn't attend.
Yeah, I mentioned that I would have them put back on there so they could. Again, I haven't heard from the builder. I can speak to it if you like. I can give you some additional information from the building inspector on the situation. I can kind of tell you why I'd asked them to come and talk to you too.
Okay.
If you want to wait till 7:10 for that.
Yeah, we'll wait till 7:10 for that.
Okay.
That sounds good.
So it's just an FYI. I'm looking through the packet. I didn't see the, yeah. Now I'm seeing him. Okay. Never mind.
While we're waiting for 7:10, I just wanted to mention we did get a letter from Alex McCurdy regarding the shelter planning and redeveloping the Littleton shelter plan. He states the last official rendition appears to be in 2015, then being driven by Ann Laurie via her position on the Board of Health. I believe it's safe to say that the revisions will reflect somewhat more on emergency management, given the authority having jurisdiction during a declared emergency falls mostly on the emergency management director, who Alex reports to. In order for any plan to be effective, the town and community as a whole have to come together. I'm reaching out to you to determine the level of involvement you or the Board of Health want to have. The first meeting, dust off of the 2015 plan, will be Wednesday night, I guess tonight, at the Littleton Volunteer Corps meeting. I expect the process to culminate in at least one operational drill over the next 2 months. So that's just something we can discuss in regards to the level of involvement the Board of Health wants to have in the emergency management update to the shelter plan. Kevin Davis, do you have any comments?
I would like to see a copy of the shelter plan. I don't have one in front of me to take a look at. I would definitely like to take a look at it and make comment.
Okay. Dan Kane, comments?
The same certainly between the emergency management director and the Board of Health are probably the two primary regulatory authorities, is, you know, as far as a shelter, a crisis of shelter, a crisis in which a shelter plan is necessary to be utilized. You know, certainly other folks will be involved in it, but if we're thinking from the public health side, it's going to be us and the emergency management director under their authority. You know, natural disaster, it's going to be all hands on deck. So certainly having us be part of that mix and helping coordinate or at least support the public health needs for, you know, if we have a gymnasium or a school full of, you know, evacuees from a neighborhood, a section of town, or from a neighboring community, that they're all going to have, many of them are going to have medical needs that are going to need to be supported. And that's going to fall on, again, the fire chief as EMD and us really. And Jim's team for the next year, at least, to help support that piece. So
Kevin, I think I have a copy of that, so I can email it to you if you want to get it out to people.
Oh, that'd be great. I'll forward it along. Thank you.
We, again, I think we used it once or twice, maybe one of the ice storms. I think they opened up I'll get this wrong. It's either middle school or the other one that's on
Russell Street.
Russell. Yeah, okay, I was going to say Russell. Yeah. So, and very quickly realized we didn't have the power that we needed to do things. So, it's interesting to do a setup and then realize. So, and then Alex was there. So and Larry was on the board at the time. But yeah, let me get that plan to you so you can share it.
Okay, great. Thank you.
Yep.
All right, it is 7:10 and we'll open the public hearing for 9 Wellington Drive. Jim, why don't you go ahead and give us some background on that?
Sure. So the houses at Wellington Drive are on a shared septic system. So there are 5 houses that are 4 bedrooms, and they all go down to a shared tank, shared leaching area. One of the unique things about a shared system is in their deeds, it is determined the number of bedrooms in their house. So kind of like a deed restriction, most houses deed don't describe the number of bedrooms. These ones do. The house in question, the way I've counted the rooms, has 9 rooms in the house total. And they submitted plans to finish the basement that were a little vague, and so we asked them for some additional information on that. There wasn't that much more information, but one of the things that showed up was a little bit of a half wall between the full basement. So again, without the detail, I wanted them to kind of present it to you. In the meantime, I've spoken with the building inspector, who essentially states that it's one big room. So whether you're okay with it because it's really just one room over, I guess I'd leave that to you. He's been in doing inspections, and that was his take on the space down below. There's no plumbing down there, which, you know, I always tell people when we look at basement refinishing, you look at what's being done in the basement to try to get an idea of, you know, the level of concern. And I don't mean that the way it sounds, because I think when I talk to people, I never doubt that they're going to use the space the way they tell us they're going to use the space. But the space goes with the house and every other owner who comes after that. So that's always there. So, and to me, that's, you know, without plumbing down there, that means, you know, the potential for things like kitchens and bathrooms. And so, you know, based on building inspector's comments, I guess I didn't really have an issue with it. So whether.
And our MO has always been that if it's one room over, it's,
Yep.
they don't even have to come before the board.
Okay. So again, the reason I sent him there was mostly the kind of vagueness and plan, but the building inspector's been in since, and kind of confirms it's one big room. So.
Okay. Yeah, if he's been in and he can confirm that. then
Yep.
that's-
Has the construction already occurred? So the basement already finished?
I don't know if it's finished, but as these things sometimes happen, it works in progress. Is that a good way to say that?
It certainly saves time if you do the construction before the permits are issued. That certainly, you know, accelerates your timeline.
Yeah. So, but I'll confirm with the building inspector before, and then get back to you, Kevin.
Sure. Yeah, I mean, it's as long as it's just one big room and a total room counts no more than 10, then we should be okay, right?
Yep. And again, because of the type of development, because it's a shared system, the information about the number of bedrooms is already listed in the deed.
Mhm.
So anyone who buys that house know they're buying a 4-bedroom house.
So it's clear.
Well, depending on how much reading you do at the closing, I suppose it is.
Right.
Yes. It's good to see the eye rolls from everyone. Thank you.
So is anyone from 9 and Wellington in the audience? Just raise your hand. Okay, I think not. We have 2 minutes until our next public hearing.
Typing like mad.
All right, it is 7:15. We have the public hearing regarding the residential trash hauler regulations, making any changes or edits for adoption. Did everyone have a chance to look through? And I know we're a couple members short, so.
I never received the electronic version of that before the meeting.
Okay. We should probably wait for Matt Weiss and Gino to be here as well to deliberate that. I'll make sure, should I just send out an electronic version to everybody just so they have it in their inbox?
That would be great.
Jim, are you able to put a note out to haulers in the area that we're looking to adopt new regulations to see if they can come and attend our next public hearing on this with any input?
Sure. What I'll do is I'll drive around town, see who's in town, and I'll send out to those companies.
Okay. I think it's, is it Harvey that just bought up Waste Not? And they own a couple of the other ones?
Yeah, that's my understanding. Harvey's made some acquisitions, so.
Okay. And there was a question from council regarding chapter 222 on dumpsters. She said this draft doesn't contemplate anything about dumpsters while the old regs discuss dumpsters. Is the board looking to revoke chapter 222? And I didn't really understand her question, Jim. I was hoping if you could fill me in on that.
So those were the de facto regulations, I guess, for rubbish in town. So I think what she's asking, are you going to replace those with the current ones? And if so, maybe want to consider some of the dumpster information. If we get complaints, they're generally about dumpsters, and we don't get a ton of complaints. Usually it's, it hasn't been emptied in a while, or it's attracting rodents, or people are bringing them too soon or too late, or the trucks are dumping them and it's banging. I mean, those are the concerns that we get, or sometimes the truck is leaking kind of goop out of it. And so whether you wanted to incorporate some of the dumpster information there. The other thing I can ask too is I know as part of the building permitting process, they have a line there for dumpsters, and I don't know if they make them get a permit or just a check off for that. So I could check and see what they're doing there and kind of report back to you.
I think the fire department issues dumpster permits.
And I think part of that was the concern had been that sometimes they just plunk them down without giving thought to where a fire truck might have to go. And so that gives them the ability to say, hey, no, you can't put that there because we need access, or it's blocking the road, or blocking line of sight.
So at minimum, I will have council include some language regarding dumpsters into these new regs that will cover us, and we'll be able to revoke the chapter 222.
That's right. You could just replace these if that's what your intent is. Yeah.
Okay. Just to have all the bases covered.
Because there's some companies who don't do residential rubbish, that just probably do dumpster services. And so if you want to make sure that you're covering those folks for the off times where you might have to do some regulatory action, that would be good.
Okay. Let's see, anything else on those? So hopefully if we can schedule this public hearing and continue it to our next meeting, we might be able to wrap those regulations up.
So you'd hope to have your June meeting?
Yes, it would be June 8th.
Okay. I just want to make sure that when I talk to the companies, I'll just let them know that that's when it will be.
Do you have anybody on except for 50 Gristmill at this point for June 8th?
Not that I'm aware of, but plans sometimes just come in. So
we have a couple weeks. So.
Yeah, I haven't seen anything come through yet that would require a hearing at this point, but.
Is it appropriate to just have a quick discussion about that one case we talked about, 50 Gristmill?
My thought is, as long as you're not taking any action on it.
Yeah, just to fill everybody in.
Sure.
I know I've seen this address out there since I've been on the board, maybe even before that. So if you could fill these guys in too.
Sure. So there's a property on Gristmill. The gentleman runs a business. I think I'm not sure if it's morphed in time. I've talked to him a little bit recently. It sounds like it's a similar kind of business where it's kind of a combination of antiques and estate kind of cleanouts of houses. And so they clean the houses out, deal in antiques, go to shows. They take the stuff from the house. This is what has happened in the past. And they take the stuff that's valuable, sell it. The rest of it gets thrown away. In the past, a lot of that stuff seems to come back to the house, maybe for processing. We've had actions in the past explaining to the folks that by bringing all that stuff back to the house that you intend to throw away, you're kind of acting as a de facto transfer station. And that's a regulatory term in the solid waste regulations, and they're not site assigned to do that. So in the past, we've recommended strongly that if he's doing those kinds of cleanouts, think about what's going to get thrown away, either get a dumpster on site at the house, get rid of the stuff that they don't want to, and then bring the stuff back that he intends to then further sell. Sometimes the amount of stuff that gets on the site gets a little carried away in the boxes that come back with it. And so I think we're at that point now, but we've been there a couple of other times and they clean it up and then it kind of gets out of hand. And so I got some, kind of complaint through the building department that it had gotten to that point again. And when I went by, they had a very large dumpster in front of it. That went away. Large dumpsters these days are about $800 a dump. So they're kind of pricey. So I'm not going to speak to why he can't do it all at once, but he has requested a hearing to the board. He understands he needs to clean it up, but the time frame, we give a general 30-day timeline. It requests some additional timelines for whatever circumstances that he wants to present to the board. So that's where we're at. I mean, it's just a lot of accumulated material.
I actually passed through that neighborhood this past weekend. I think it's like a pale blue kind of ranch on the left-hand side when you go onto Gristmill, down a little bit on the left-hand side.
Going up the hill? Yeah.
Going up the hill on the left-hand side.
Yes, on the left. Yes.
Yeah, okay. I actually was going to bring that forward going.
Yeah.
I have not passed down this road in a while and had noticed it and was actually going to ask if this is historic, if this is a hoarding situation or an elderly who may need help or support, what kind of resources they may need. But it sounds like it's complex, but at least a little more straightforward than the elderly who simply is unable to manage things. It sounds like it's a little bit more a systems process than a personal process. So
I think complex is the best way to describe that one.
So just let me know what time, Jim, for them on June 8th.
So, whatever's best for you, if you want to start right off and do that one so that you have more time.
Yeah, let's do that right at 7. And
I was going to say, he won't, if it's 10 or 15 minutes, depending on the number of questions that you all have, and that may be. So we'll put him on for 7, you said?
Yep, that sounds good.
Okay. And I'll let him know tomorrow.
Okay. So with that said, I think we can, I'll make a motion to continue our residential trash hauler public hearing to June 8th. And why don't we make that 7:15? Is there a second?
I'll second.
Okay, there's a motion and a second. Roll call vote. Kevin Davis.
Kevin Davis, yes.
Dan Kane.
Dan Kane, yes.
And Kevin Baker votes yes. We have a couple of minutes before our COVID update. Dan Kane, the last minutes you sent over were from was it April 27 or 29? I'm sorry. Oh, no.
I believe I was going to say the May 11 are not
May
quite done yet. So it was the
Okay.
meeting before that.
So April 27.
checking my email to make sure it went out.
Well, I just don't think we have enough folks here to.
I was going to say, because I think Kevin would have to abstain, so it would just be the two of us. So while theoretically it's not the majority of the board, it's the majority of the quorum, we could, but I think it's probably just, it's reasonable and still not overly long before we get it out to have everyone be able to vote on it.
Okay.
Yeah, that was the 27th.
Regarding future minutes, I had correspondence with the Director of Elderly Human Services. And there's a program there, it's a tax work-off program where they have folks looking to get a rebate on their taxes. And the director is going to post the job description for a note taker, meeting minute taker for the Board of Health in July. I guess their fiscal calendar starts in July, so they'll be hopefully able to help us out at that point.
Would that be for the would that be for the next fiscal year, July to June of 2023, or is it just a month-to-month thing?
I don't know how they structure it. In a perfect world, it'd be for the fiscal year, or at least until we get some administrative support up and running.
Have there's been any word on admin support from the town?
No, I do have a meeting with the town manager on Tuesday. Hopefully we'll get some answers. I'll report back to you. We have a hand up in the audience, Ed Mullen.
Can you folks hear me?
Yep.
All right, great. Thanks for letting me join. I did want to give an update. There has been a candidate interviewed for the office coordinator administrative assistant position. There's been an offer made. The individual has to go in front of the select board June 6th for the grade and step approval. But the individual has 18 years of municipal and public school experience, and she also has been working for a prestigious university for the last 4 years as an executive assistant to 2 professors. So we're hopeful that we can come to an agreement and get the approval of the select board for the administrative assistant. So we look forward to it as much as you guys do, because I know that you guys are in desperate need of support as we are. So we're hopeful. Certainly invite you, Kevin, to stop in and review the resume and the interview process, and we'd love to share the information with you guys.
Just come on into the office. I'll give you a call and we'll set up a time. And
That'd be great.
do that.
Thank you.
Thank you. Two minutes. All right, it's 7:30. We have our COVID update with Katrina Wilcox-Hagberg. Hello.
Hello. How are you guys doing?
Doing all right. How are you?
Right here. I'm here. All right, I'm assuming you can see the slide kit at this point. All right, so we will jump into the state data. So this is that Boston wastewater biobot measurements. This is that form of surveillance that just monitors the amount of COVID in the sewer system. And this is a good early signal about what's happening without having to rely on testing, access, and hospital data. This data typically has been showing around 2 weeks ahead of the other data, what will happen. And so over the most recent period, we've had this 6-week rise in the sewer levels, but in the most recent days, there's been a drop. We've had these kind of drops before, and then they can level off and go back up, or it could continue back down. So we need a little bit more time to see if this decline holds, but I will hope that it holds. Looking at the DPH website, the DPH data, the cases have been increasing. They're now at a 7-day average around 2,300 per day. Keep in mind that this does not take into account any positives that are on at-home rapid tests. So we know these are an undercount. And these case rates have been increasing since the beginning of April. And in the most recent days, they've leveled off, maybe dropped a bit. So we need another week, a few more days to see what's happening here. Test positivity has continued to trend higher, now at 8.3% for the state. Hospitalizations have continued to rise and now averaging 820 per day. This has been really over the last 4 weeks. It looks like we might be leveling off now, or the rate of increase is slowing. So again, this is something we need more time to see which direction it's going to go. And deaths are thankfully low, averaging about 10 per day, but this is higher than it was 4 weeks ago. And if you can count 10 deaths per day for a year, it adds up substantially. So something to keep in mind. So this is the case rates per 100,000 by age group. And all age groups have had this increase in cases since the beginning of April. Again, these are undercounts. These are the DPH data, which only reports those positive PCRs or rapid antigen tests that are done at facilities that can report that data to DPH. All age groups are kind of in the same spot right now, but the 5 to 14-year-olds had this really sharp rise right after April break when they got back to school. So I also wanted to point out this little table to the side. So we know that the DPH data is an undercount, but this is probably the only way we can look at how much of an undercount is to compare the cases that are reported into the DPH to those reported by DESE. So DESE is the Department of Education system in Massachusetts, and they have schools report all positive cases to them weekly. And they also capture the students and staff who are test positive on at-home rapid tests. So if you look for the last 2-week period that the DPH reported for 5 to 19-year-olds and the last 2-week period, which DESE reported for school-age students, you can see that DPH reported 10,660 cases, whereas DESE reported 28,258 cases. So the DPH data is an undercount and around 2.7 times lower than the DESE data. So something to keep in mind, it's not a minimal amount of underreporting happening in this data that we've been talking about. So when we look at hospitalizations, we know that the rates of hospitalization have been going up, that 880 per day mark, and looking at hospital capacity, which is another important metric. 92% of our medical surgical beds in our state are now occupied. 81% of our ICU beds are occupied. So nowhere near the top of the surge we had in the winter, but definitely not a lot of cushion there with open spots. So this CDC has created their new community levels to give people an indicator of the amount of COVID in your area. They do this by looking at not only case rates, which again are based on those undercounted cases, but also looking at hospitalization indicators such as new COVID admissions per 100,000 in a 1-week period, and also the percent of staffed inpatient beds occupied by COVID patients over the 7-day period. And when we look at this, Middlesex County is classified as a high community level area. It's technically in the orange, so not red, but orange, the highest level, as is Worcester County and many of the counties here in Massachusetts and southern New Hampshire. And so the areas around us are also high. And then, so just to point out what the CDC recommends, that individuals take precautions when community levels are high, and that includes wearing a well-fitting mask in public indoor locations, including K-12 schools and other community settings, staying up to date on COVID vaccines, following the state and CDC guidelines for isolation and quarantine, getting tested if you're exposed or if you have symptoms, and maintaining good ventilation in indoor locations. And if individual is immunocompromised, they suggest wearing a better quality mask or respirator and talking to healthcare providers about what other actions they should be taking. Excuse me. And if you have a household contact or a social contact who is immunocompromised, it makes sense to take extra precautions before visiting them, like using an at-home rapid test or wearing a mask when you're around them. So when you look at Littleton data, I'm presenting the number of cases a little differently. At this point, like I just showed you in the earlier slide, we know that the DPH data is an undercount, and we know these definitions have changed over time. And we also have our school cases that we can compare. So this is another example of how the case definition reported for our town by DPH differs from that of the school's reporting. And depending on which data source someone looks at, they might get a different impression of what's happening. So since we started tracking COVID, the cases reported for the town as a whole had always been higher than the cases reported for, which are blue, the cases reported for the schools, which are orange in this graph. But you can see in the most recent weeks when we've had this increase recently since the end of April, that the schools are actually reporting more cases than are reported for the town as a whole. And that is because the schools are reporting to DESE and to the town on their dashboard. Their counts include those at-home rapid tests, where positives on those at-home rapid tests, whereas DPH does not capture that and report that out for municipalities. So I do think it's something to consider that, if we're in a period of time where we're relying on individuals to make good choices for themselves and their risk tolerance, just to make sure that people know that what the data is for a town as a whole and how they might differ, because that depending on which source someone's looking at, they may make a different choice if they see things that are different. So something to consider. So when we look at the areas around us, Littleton, this is data through May 14th from the DPH. The average daily incidence rate in Littleton was 70 per 100,000, and it's been trending higher for weeks now. The other areas that we track trended higher as well. Their rates are 44 to 58 per 100,000, so Littleton's actually a little higher than the surrounding area. And our test positivity is 10.6%. So at this point, we know we are undercounting. We're not capturing all the positive peoples in these case numbers, which we know from multiple data points at this point. So we do have a good amount of COVID in our area when you start thinking of the CDC measurements, our town counts, and the state counts. And then this is the schools, just looking a little closer so that you can see the snapshot of the schools when we just look at them themselves. This is the data reported on the dashboard for the last 6 weeks, with the last week being May 20th. Remember that the schools update their dashboard every Friday, sometime after 5 p.m. Schools have trended higher for around 6 weeks. And then last week was the first week we had a reduction in the number of cases that were reported by the schools. So we do hope that this trend continues. But I do think we need another week or so to see which way the trend is setting up. I do have to say each school has actually had a different pattern over the last 6 weeks. And I suspect that that is due to different behavior, different developmental stages, and different social opportunities for each of those age groups. So it'll be interesting to see how this unfolds over the rest of the school year. And all schools have been, they've been reporting the 2-week prevalence for the districts around 7%. At this last 2-week period, it was 7% for about all the schools. So right now we're a good amount of COVID has been around in the last 2 weeks. And I do think it's important to realize why a 2-week prevalence is meaningful. So a 2-week prevalence gives you an idea in the second week So the most recent week, how much COVID is in the building. And that is because around 50% of people who are returning from isolation the prior week are still infectious, and they can be contagious to others. So there's potential transmission risk among people returning from isolation, as well as new cases who are being identified in that current week. So the idea for a 2-week prevalence is to give you information to determine what mitigations you are needing in that moment to see if you can reduce transmission risk. So looking at vaccination, again, the last time I was here, these hadn't changed, and a few weeks later, they still have not meaningfully changed. This is as of the May 19th DPH report. We are still 87.9% fully vaccinated as our community, which is awesome. But I actually don't expect this to meaningfully change until a vaccine is authorized for 0 to 4-year-olds. At this point, I think that's the next push, if and when that ever happens. And this is the booster or up-to-date status. So to be considered up-to-date on vaccinations, individuals need to complete their original series plus a 3rd dose after 5 months of an mRNA vaccine, or if it's J&J after 2 months. Approximately 90% of Littleton's fully vaccinated population are eligible to be up-to-date, of which 75% have received a booster and therefore are considered up-to-date. And as a population, 58% of our residents are considered up to date in the classification. And there's room for improvement in this up-to-date status for the 12 to 15-year-olds. That group came out of the gate early and fast for their vaccinations, but they've been lagging on boosters. So I don't know if there's messaging that could be done for that group of meaning, vaccinations, or if their doctors are having conversations as they're seeing them, hopefully. And then in the last week, 5 to 11-year-olds just became eligible for boosters. So 25% of that age group is at least 5 months out from their 2nd dose. And those individuals are now eligible to go out to get their booster. And against Omicron, that 3rd dose is really meaningful because Omicron can break through immunity, not only prior infection immunity, but also vaccination immunity. So getting this 3rd dose really helps to strengthen the body's defenses. So speaking of vaccination, getting vaccinated, staying up to date is important in a meaningful way to protect yourself from the most serious impacts of COVID-19. So like I just said, age 5+ are now eligible to receive boosters. Age 50+ are highly encouraged to get their 2nd booster or 4th dose. And you can find vaccination status or sites who are offering vaccination using the state's vaxfinder.mass.gov website. I think there's also an eligibility checklist in case you're not sure you're qualified for another booster yet or not. And then the schools sent out an email and that the town and the schools have coordinated another vaccination clinic on June 8th at the middle school. I have to say it's been really nice to have these vaccination clinics brought to town to make access to vaccines easy for our residents, but you do need to visit this website listed here in order to make an appointment at this clinic. So I'm not sure if that's a way we can broadcast that further in the social media and email channels from the town, not just through the school. And then just before I end tonight, there's a lot we are learning about COVID, and not only hospitalization and death risks, but also new research is coming out frequently, almost daily, on describing the breadth of impact on organ systems that COVID-19 infections can impact, such as heart, lungs, kidneys. There's other issues involving blood circulation, gastrointestinal conditions, and lots of neurological problems. And I am just skimming the surface of things that are being described in literature. So there are a lot of reasons to protect yourself from infection, even if you've had a prior infection. So of course, like I keep repeating, vaccination is a strong way to protect yourself from COVID-19, but it is not the only tool we have. Maintaining good ventilation, and especially in public locations shared by many, or using portable HEPA filtration systems to remove virus particles from the air is a really important step that everyone could take to help reduce risk. using those at-home rapid tests to prevent spread to others, whether you're visiting an immunocompromised or high-risk individual, or if you have symptoms and you just want to make sure, am I currently contagious? Those at-home rapid tests tell you, do I currently have COVID, and am I currently at a contagious level? So they're a very powerful tool as well. The CDC, just to reiterate, recommends that in areas of high level of COVID, like we have in Middlesex County, that individuals should wear a well-fitting mask in indoor public locations, and including K-12 schools and other community settings. And then they also encourage everyone to follow the mass isolation and quarantine guidelines to make sure that we're staying out of public places when we are most contagious. And it is important to know that around 50% of individuals are still contagious on day 6 when they are allowed to exit isolation. So if you are exiting isolation, it's really important that you wear a good quality and well-fitting mask to protect the others around you from spread. Or if you're able to take a rapid antigen test to determine if you are still infectious or not. Those two things are, again, really useful to help prevent spread to others during a time where you still may be contagious. I think there is a misconception that people think if once they hit day 6, they're fine and they can just go back to life. But there's this period of time where you are still contagious, even if you are not symptomatic. And there are, thankfully, now multiple therapeutics that can help treat COVID-19. There's a preventative medication called Evusheld, which can help moderately or severely immunocompromised individuals as a preventative step. There are antivirals like Paxlovid or remdesivir, which can help stop the virus from multiplying in the body. And there's also monoclonal antibodies that can help the immune system to recognize and respond more effectively to the virus. But the timing and starting of all of these medications really matter. You need to get access to these medications early in your infection. So you really need to make sure you talk to your healthcare provider early in your infection, or if you're at high risk, talk to them now so you have a plan to see if you qualify for this types of treatments, and then make sure that you know where to access them if you need them. And that is it for today.
Thank you.
You're welcome.
Kevin Davis, any comments, questions?
Katrina, thank you so much for that. That was very informative and an excellent presentation. I especially like the new data format where you've got the blending of DPH data along with the DESI data, or the actual Littleton numbers that are there. That was very helpful. My question to the board is, what kind of steps besides strong recommendations should we start to make or take to start to say, hey, we've got high numbers, high positivity rates. What kind of things can we do to start to help mitigate things other than a strong worded recommendation that people should wear their masks indoors and at schools and things like that?
That's a good question. I think we'll talk about that as we move on to the ID's decision support tool. There's Matt Wason can't be here, but he did write a letter in his absence, so we can discuss that.
Okay.
Dan Kane, questions, comments?
No, thank you as always. We've all been watching the numbers pretty closely, and they're not going the direction we want. And looking at where our numbers are, we're 70 cases per 100,000 for the last 2 weeks. That's higher than we've been in a very, very long time. And certainly that the severity of illness overall is less since we are so highly vaccinated. It doesn't, I think we're all at this point going, well, most people are vaccinated, most people don't get that sick. And there's a level of complacency that goes along with that. And we're back to a bit of, art versus science here for numbers in clinical care of, okay, well, 70 cases per 100,000 a year ago is huge red flags. Now we're not looking at it quite the same way, but we're still not necessarily thinking about those vulnerable populations and the impact of, certainly for how many kids we have, 134 kids in the last 2 weeks in the school system that had come up positive. It was 80 plus, I think, 50 something. 130 kids.
134, yes.
134 kids the last 2 weeks who have come up positive, which means they've missed at least a few days, even if they, it fell funny on the weekend, they missed at least 3 days of school. That is a lot of school days, all at once, of missed time for our students. So even without severity of illness and hospitalizations, minimizing the risk of long COVID and those other long-term complications, simply the loss of productivity, whether that's for faculty, students, all of us in our community, that's really, really concerning. And, I think we certainly messaged pretty aggressively, about personal responsibility and personal actions to help stop the spread. We're at a bit of the end of the PR curve now. Again, that, it's hard keeping things going. It's unfortunate, but it's hard keeping that going. I'm just not sure either. I think we'll continue talking about it, but it is seeing those numbers a little bit more concrete and trying to put those back into perspective of Littleton. We're the highest in our peer group right now for cases, and we're looking at other communities. I know Brookline had just implemented masking for their schools again, and their numbers are 60 per 100,000 community-wide based on the DPH numbers. I'm not sure what their school numbers are, unfortunately, but but as a community DPH numbers, we have a higher case count than Brookline, and they've taken some mitigation trying to manage that vulnerable captive population in the school system where you can't choose not to go to school. You need to be there. I'd love to see how we can effectively get these numbers down so that we can wrap up with a strong school year for our students, our staff, our community, as well as just, for all of us who've been trying to work. And I'm pretty much guaranteed that everybody here knows somebody who's been out of work in the last week because they've been positive. So, certainly that's luckily my circle. Lots of people have been sick, but nobody has been sick. But there's still that concern that, it's good that the severity is down, but how do we move forward and how do we help folks break this curve? And I agree that message of day 6 is not a magic number that, oh, now you're fine. Of how do we enforce that or reinforce that knowledge that, a negative rapid is pretty suggestive that you are not, infectious. But you need to actually take the test before you walk back out into the world, and particularly into closed environments.
Katrina, just 2 questions. One, if folks are still contagious on, from day 6 to day 10, why are they leaving quarantine?
The state guidelines recommend testing, but they do not require testing. And Jim probably has that better on the top of his head than I do.
Yeah, Jim, tell us.
I guess the idea is they're potentially less infectious. And so that's why with the mask, and we don't necessarily disagree, and they don't always provide us with the best of rationales for why they do things. One of the things I was mentioning as you were all discussing, sometimes the difficulty with these guidances, Department of Public Health came out with revised guidances today, effective today, without much of an explanation for children. So it's called COVID Isolation and Quarantine Guidance for Children in Childcare, K through 12, out of school time, and recreational and camp program settings. So we're trying to digest that now. Part of the concern we have, we're still doing contact tracing, and there are at least 3 sets of guidances, depending where you fall. If you're a family that has a kid in daycare and a kid in public school and you go to work, there's at least 3 guidances that you're following. This adds kind of a 4th to it. And it is hard when you're doing contact tracing and you're describing to someone that they can do something while somebody else can't do something, and because you're trying to navigate this chart about mask wearing. I don't want to say concern, but it would have been helpful for this new guidance, and I'll send it out to the board. It's on the page. They just kind of put a new line down on the mass.gov COVID page where they talk about all the guidance. And there's a new line down there as of today. One of to me, the biggest change is that quarantine for asymptomatic exposed children, regardless of where the exposure occur, is no longer required for the setting. So they've kind of changed the quarantine guidance for asymptomatic kids no talk of vaccinated up to date regardless. So again, we're trying to digest what this all means as we're having conversations with parents. We know that kids out of school challenges everybody in the household. We also know that, particularly young kids probably get very close to one another in daycare and school settings. And the potential for somebody who doesn't show symptoms a whole lot, so it may be asymptomatic but infectious, showing up at school. It's just it's a challenge. So.
My next comment was, in Jim's weekly COVID report that he sent out, I believe, Jim, was it 96 cases?
Yes.
In Wellington? Is it safe to assume, Katrina, based on the data we're seeing, that correlation you made between the DPH data and the DESI data, that's closer to like 270 cases than 96?
2.7, yeah. It's probably like 250, 270. And I think that actually fits with the schools. Like the schools were...
And if the schools are 10% of what the town is?
Not 10%, it's like 30%. So if they're down this week, hopefully. Yeah, I mean, I think it's the right range. And it makes sense with households. Like if there's 150 kids in schools, individuals in schools who have COVID, and then we know it spreads in households, then I think it's reasonable. You got 2.5 at home. Like it all keeps circling back to the average family size, the difference. So it makes sense. It's very hard. I mean, I can't tell you how many people I talked to who are like, it's fine. We had 40 cases in Littleton a couple of weeks ago. And I was like, but have you looked at the schools? Like, I know they're capturing all the data, and it's just, I don't know. It's becoming harder to find the COVID data on the Littleton website. I actually had to Google it today instead of just being able to click on it. And I know you guys report the cases from DPH, but the schools data isn't linked. The CDC's community levels isn't linked there either. And I'm wondering, which are the most meaningful data for us to share if individuals are the ones needing to make decisions for themselves? I don't have a feel for that.
Unfortunately, I think it's a little bit of everything. Hence the reason why we're trying to get to this decision tool.
Yeah.
To try to get to that.
Yeah, and we can actually open that.
So if also I'd like to hear from the board, is there a way that the board could go back to the town and ask them to make sure that link in the data is forward facing still?
Yeah, I just actually put that on my list of things to do. So, Katrina, to answer your question, I think that what really needs to happen is to get the people the real numbers, is to basically put it out there and say, we're not getting the full picture based on DPH numbers, based on our calculations, we're not at 96 cases, we're at, 250 to 270 cases, and here's where we came to that conclusion, make your own decisions and plan accordingly from that number. I mean, that's more of a grassroots effort than taking hard and fast data from a system that the state runs, but it's probably a lot more accurate and would be maybe more effective. And I mean, it shows that, we care on a local level.
I wonder.
Go ahead. Okay.
Sorry, I wonder if there's also something that the board could reach out through our municipal board's representative and ask the DPH to start to maybe consider or figure out a way that the DPH could consider at-home rapid positive tests or something like that, put it in the Maven database as a trend or something, because that would help out. Or are they just totally against that? Maybe Jim has some data on that. I don't know.
Would say.
I'm sorry.
What do you think DPH's opinion of that would be?
So when they're doing the reporting through, they use certain case definitions, and that's how they're reporting. I think, and again, I don't know for sure. I would be surprised if they traveled that way, just based on the kind of conversations that are being had. Again, there's not a lot of quality control with everybody who does their own testing, and the tests have different sensitivities, and so I think there's some challenges with them being able to accept that data and then how to frame it, how to actually say what this is and what it might potentially say. So, but our public health nurse sits on Maven meetings. I think there would be Tuesday morning. I could certainly ask her to ask and see what their thinking is on that.
I think
Okay.
Sorry. I was wondering if we can, certainly we are never going to get a really solid hard number where we are. Is there a way that we can request, certainly my guess is these school nurses are tracking how many cases they report to Maven through their pool testing or symptomatic testing, and how many they're getting phone calls, my kid's out of school today because they're positive, we'll see you in a week. I do not know if they are tracking it that way, but I would, if they're not now, perhaps that's something they could track and be able to give us that number. Okay, of our 134 cases in the last 2 weeks, we have reported 50, 100, who knows, whatever that number is. I don't know. I don't have a sense of what that is. Less than 96 or less cases to Maven they've reported. But that'll at least give us, again, it's still, there's still going to be a little bit of a, an art to that number, but at least can give us a better sense. If we know we have 96 Maven cases in our DPH report, okay, are all those captured in the Maven data from the schools, or is 25 or 30 or 50 captured from in that 96 from the schools, and now that difference is 80? So now we have a better sense. We're going to never going to get an exact number, but at least narrowing that, that percentage of error of that. So we can go, yep, okay, our estimate of a true number is 120, 180, 200, based on schools only reported 20 to Maven out of 130. So we now know we have 96 plus that difference is going to give us a better sense of where we are. And that's probably something we have a little bit more local control of, having that level of just simply monitoring and that sense, where DPH is probably getting DPH to statewide change their reporting structure and their tracking process. If I take a test at home, as opposed to a lab test where they've got some patient identifiable trackable data, Dan Kane is just one more Dan Kane in Massachusetts, and making sure they're matching my data from my home test versus a PCR test, all, and make sure that they're not double counting. They're unlikely to make that change. Point of care testing is great, but point of care testing is still not lab testing, where this could be actually doing it locally in the schools, not 100%, but probably going to give us a more realistic number. Because we can say, okay, we're at 240, or we're at 100, or the lowest number, 134, and that all those cases are captured. That's a wide variability in guessing. So perhaps, we can talk to Superintendent Clenchy, talk to the school nurses and Lynn, and see if that's something that they are doing already. Can they share that data? If they're not doing it, I hate adding more workload onto these school nurses. But is that something? My guess is they've got a list of who's positive. I would think they're constantly working that list of, here's my positives, here's what day they're on. When they come back, have they tested? Have I checked in with them, make sure they're negative and they're masking? It's adding to their workload a little bit, but I'm hoping it's simply asking them to share their master grid of who's positive, who's coming back with us. And even if we do a little bit of number crunching of going of where they are today, as of to match up the data dates, I'm just trying to come up with a way of being able to get a better sense of where we are community wide. And I think that's probably that off the top of my head, that's the best one I can come up with to try to narrow that range down.
That makes sense.
I don't know. I'm just trying to come up with ideas as well, because it's hard working with a data range of anywhere between 96 and 250. That's a hard data range to work with.
And if the board has trouble with it, what does an individual in town do with it?
Yeah, Dan, I'll circulate an email after this meeting. We'll see if we can get the wheels turning on that.
Great.
Well, thank you, Katrina. As always, we appreciate you. Great work. So we can open the public hearing for the ID decision support tool. Matt Wason is not here. He did send over some documents and an email, which I'll read. It's addressed to the board. Board, I've attached the latest ID decision support tool for the board's review. Several of our metrics have worsened since our last meeting, and there appears to be no slowdown in our case counts. I'm incredibly disappointed to find that at this time, Littleton Public School dashboard has not been updated since last Friday. I think he sent this email at like 4:42 when they updated at 5 p.m. So he just missed it. But he can only assume that their numbers are following those of the community and that the prevalence rate is higher than last week, which it was mixed. So our 2-week case count numbers are now higher than at any time in all of 2021. And we understand that they are likely much higher due to the prevalence of home test kits, which were not as available last year. We have not been above 100 since early February, but we are at 96 this week. And as we just discussed, it's probably closer to 250. Wastewater numbers continue to climb and are both now above 1,000 copies per milliliter. Good news is that vaccine boosters are now approved for anyone 5 and up. The bad news is that despite our community's already high vaccination rates, we are continuing to see an escalation in case counts. While the disease appears to be relatively mild for most people, my concerns center on our at-risk communities, the additional sequel that come from the infection and the risk of more dangerous variants in the future as we continue to let COVID exist, spread, and mutate. There are other communities and schools implementing mask advisories and mask mandates in a variety of settings. I feel we should push for an immediate mask mandate for municipal buildings and at a minimum an urgent advisory to wear masks in all other public spaces. Respectfully, Matt Wason, MD, Vice Chair, Littleton Board of Health. So I wanted to read that letter, and I know you all have seen the ID decision support tool stating that ICU bed access is 84%, which puts us in that sort of medium yellow range. CDC community level is red and high. Up-to-date vaccinations, 60 to 80% in that, or 74% in that yellow range. The town public school prevalence, the 14-day case prevalence rate is, at that time, it was greater than 10%. Now it's in the yellow range, 4 to 10%. Wastewater greater than 1,000, and neighboring towns with restrictions 0, and statewide no statewide restrictions. And then he put a little table in there, a little chart on the 2-week case counts that Katrina just went over thoroughly. So, so at this point, you know, I'll open this up to conversation between the 4 of us here and see what, if anything, we want to do. Kevin Davis.
So I've been putting a lot of thought to this and seeing some other towns like Brookline and other towns going and implementing a mask, mask mandates and things like that again. With the numbers going up as they are, I don't see a way out or around from this without the board, issuing some stronger guidance or issuing a mask mandate. I definitely agree with Matt here as far as, immediate mandate for the municipal buildings. And I think we need to strongly consider what we're doing about the schools. As we've seen before, a lot of, they're talking about, kids passing around COVID within the schools and then bringing it home and then having the incident rates go up. It's just the way the virus works. So we got to really look at all of our options and strongly consider something to slow this down an awful lot. I think we should have probably had some action taken earlier, but I think we need to look at it now.
Dan Kane.
I think our number of time we just talked about it. I'm certainly concerned about the schools simply because while the severity of illness is relatively low, the incidence is very high. I'm glad the numbers are now down to 7% from the 10 and 13% for some of the schools they were the previous week. as far as action, the superintendent and or the school committee could take action immediately. They could, the superintendent could act tonight and make it mandatory tomorrow for all the schools. I mean, 7% is certainly a very high number across the board in our schools. And certainly as we were talking about, again, it's kind of a moot point now, but when we're talking about mask waiver requests through DESE a few months ago, that we're looking at, no, we see these numbers climbing, that, they're going to empower the school nurses to act within their schools and empower the principals to act within their schools. And certainly the superintendent was keeping, his authority as a superintendent to act system-wide. When I saw the number of 13% in the high school, I believe it was the previous week, and the middle school the week before that, I was disappointed that I was glad to see a letter from Superintendent Clenchey. I was disappointed that while listing the mitigation strategies that were already in place, there was nothing to really identify that those mitigation strategies haven't been as successful as I think any of us would hope. Since if our mitigation strategy and our numbers are still climbing, well, then our mitigation strategies aren't being effective. And perhaps there are additional measures that could be taken. And I didn't really see that coming through in Superintendent Clenchey's letter. And that was certainly disappointing that they didn't maybe perhaps look at what other options do we have. Can we go back to distancing? Do we do masking, even if it's, school by school based on our numbers? Of really recognizing what can we do? Because again, even as simply as missed school days, that is an educational issue, and that's important. But virus in the community, the schools are a huge part of our community. We're a family community, a neighbor, we're a residential bedroom community. A huge portion of our school population comes home to families every day, which means we're all part of that school community. Almost all of us are part of that school community in one way or the other. So that exposure that might be minor and a minor inconvenience or a few days out of school for those populations, potentially, again, increasing risk to families and other members of the community. Even with our immunization rate being relatively high, it's a concern. I admit I was disappointed that, that whole, let's finish this strong, let's keep kids in school the best we can, let's utilize other things that in addition to what we're already doing, which isn't as effective as we'd like it to be. I'm not sure about mask mandates. I think we've recommended repeatedly, the CDC has been very, very clear that this should be happening. We're a high risk community, a high risk county, and we're in the county, so we're high risk as well. And our numbers show that. Our challenge is community adoption of that and participation in that requirement, and business and enforcement. How do we make sure those things happen? We look at community safety. The select board, a few months back, put a 25-mile-an-hour townwide speed limit from 35 or 30 to 25 because they felt it was safer. And there's an entire structure to help enforce those behaviors to make the town safer. Unfortunately, we don't have that same piece for the public health side. Jim does a great job across all of our public health concerns and all the regs across the board, but his staff doesn't have the resources to be able to simply walk into a store, doing a regular inspection, go, hey, you should be wearing a mask. Getting a cup of coffee and go, hey, don't forget your mask. That educational piece is such a critical part of public health that we don't have those resources in our community, unfortunately, to keep that going. So while I think we need to be more aggressive in our mitigation, I'm concerned about its ability to be effective because of the challenges of community participation and willingness to participate, and the ability to provide education, and if it needs to be enforcement around those behaviors. That's my only concern. Do I think we need to mitigate? Absolutely. I'm just concerned about our ability to make it effective. And I don't have an answer. I wish I did. I don't have an answer on how to make that balance work right now.
I mean, community-wide, when I go into the grocery store, 95% of the people are wearing masks. So I feel good about that. But yeah, I mean, some people are done with it. They don't want to wear masks, or they feel like they're immune to it. They've had it, and they're not interested. And I get it. I understand that perspective. Unfortunately, the Board of Health has the unpopular job of making unpopular decisions, or the bad job of making unpopular decisions that are for the better of the greater good. I feel, just Dan, to your point, of being able to, enforce it, the first step we could probably take is talk about requiring masks in municipal buildings and schools, in Littleton. If the board had an appetite to do so, we should, Dan, you could probably tell me the proper course of action to go about making a motion and doing something to that effect. Do we have to bring town council in? Do we need to revisit our past emergency regulation? How does that work?
I certainly am not a lawyer, and I don't play one on TV. Certainly getting town council involved would probably be helpful. I think when we had enacted, because again, we were advised by town council that an order was beyond the scope of the Board of Health, that it needed to be a cooperative between the select board and the Board of Health to issue an order. At that time, the select board did not have an appetite to support that route. And that was enactable basically upon signature by both bodies. We went the route with a regulation, which requires a slightly more involved legal process of posting public hearing with the proposed regulation, acting upon that regulation, whether to enact it or not, and then publicly posting that regulation in, a paper of record with a 48-hour notice so that it can be enacted. So it's not a long process, but it does take posting public hearing with notice, acting upon it, and then posting it with, adequate time to have it be posted and be public. When we rescinded our previous order, we did just that, as I believe. I'd have to go back and look at the minutes, that we did not suspend that regulation. I believe we, in fact, rescinded that regulation. So we would be back to, kind of day zero as far as a new regulation, as opposed to simply unsuspending, not a word, I made it up, reactivating an existing regulation which had been suspended. We would need to start from scratch. And certainly that perhaps is something that in general we look at. The public health regs around authority for boards of health is pretty clear. I disagree slightly with town council that a Board of Health order for an infectious disease mitigation strategy, my read is, again, not being an attorney, is that was fully within our scope as a Board of Health, no different than ordering cleanup for a house of a hoarder situation, or remediation for any other public health hazard. That was kind of my read. But perhaps we look at our regulation and make it clear in our regulations of what the scope is of the board to act with emergency orders when an emergency order is appropriate, and not necessarily require a new regulation every time something comes along. Just because it's burdensome, and it's a hard way to necessarily act in an emergency when it needs to be done. And it's just, when I look at regulations, I hate doing regulations for a specific thing. It's, looking at waste haulers, perfectly reasonable. We're looking at a class, we're looking at a public health issue rather than dumpsters versus trash trucks versus residential. You know what? Let's look at how we manage waste in the community as a whole. That same kind of piece. And perhaps that's something we look at, a regulation, again, longer term than this issue today, but how do we address concerns in a more timely manner within the scope of the board? Even as simply as an act that, the board can issue orders for mitigation strategies for public health emergencies or infectious disease mitigation. That kind of language, just so simply that it is codified of where we are, and kind of taking that DPH language and just making sure that it's clear within our town language as well, that it is within the scope of the board. Again, obviously talking with town council and those folks just to make sure that we are that it's clear and appropriate and that we're reading things correctly. But in the short term, I think if we want to act, again, as we said, the easiest way is from a municipal building. I would think the select board and or the town administrator can say, everybody in a municipal building needs to mask when they're in the building. Same thing in the schools. The superintendent tomorrow could say, or the school committee, hey, you know what? Our numbers are high. Let's mask up for the next 10 days and let's see if we can get our numbers down. We get our numbers down to 1 or 2%. You know what? We can probably unmask it to the end of the year and not have a big bump again. For us, it's going to be a much more structured process where they can act independently within, the facilities that are under their direct authority. Again, run it by town council, but that seems to be my read of both each of those bodies' scope of authority as well as where we are, having, from what we've heard from town council, the last mask mandate discussion process.
Okay. Well, let me communicate with the town administrator and the select board, and I will report back to the board tomorrow. And depending on their response, should we need to schedule an emergency meeting on it, it's likely not going to be until Tuesday, I think, at this point, being Monday a holiday. But that'll give us a chance to see school numbers on Friday, which translate to our townwide numbers. Does that make sense?
Yeah, I know town hall is closed on Friday, but it's not a legal holiday. So theoretically, anything that was posted tomorrow would still get to that 48-hour number. As long as it went out tomorrow. Otherwise, Friday, the town hall is closed, so the clerk would not be there to be able to publicly post it.
Okay. I think they leave at 2:30 on Friday, the town clerk.
She may be working from home, but I believe town hall itself is closed because of construction in the parking lot. Okay. So there was a note saying the town hall was closed on Friday for construction.
Okay.
So while it is a business day, I'm not sure if the clerk's office is actually be open and functioning while they're not in the building, if that makes sense.
Got it.
So that might be the only hang up if that is something that we chose we wanted to do. That was make sure we meet the open meeting law 48-hour requirement.
Got it. So I will make a motion to continue this public hearing on the ID decision support tool until June 8th meeting, if not sooner. I'll report back to the board tomorrow via email. See next steps. We had an 8 o'clock public hearing. Oh yeah, does someone want to second that motion to continue?
I was going to say, we need to point of order, sir. Second.
All right, roll call vote. Kevin Davis.
Yes.
Dan Kane.
Dan Kane, yes.
Kevin Baker, yes. We had an 8 o'clock public hearing regarding the potential regulation regarding treatment for sewage disposal systems within 100 feet of the wetlands. Jim, I apologize. I needed to do a lot of homework with this and call you to discuss different systems and the numbers basically, and the quality of the effluent that is discharged into the leaching area from the different systems, because I think that, and please educate me on this, I think if we're going to do something with a regulation to protect within 100 feet of the wetlands, we should call out the different types of systems and potentially even the quality of the effluent that the board would like to see coming into the leach field from those systems. Does that make sense?
Yeah, I mean, the state calls all of these systems innovative alternatives. So things like infiltrated chambers and Presby pipe and geomass, and to the extent that they do some treatment, it's hard to quantify because there's really no measurement to them. So when I think of treatment, I think of these advanced treatment units. again, the way those are monitored, they check them for the pH of total dissolved oxygen and one other parameter. And if they're within parameter, they don't do any further testing. And the idea is they reduce the organic strength of the wastewater before it goes into the groundwater. So the total suspended solids, the biological oxygen demand, the BOD, which gives you better treated effluent going into the ground. Do you want to make a choice? If I was going to do something, it would be more between active treatment and the kind of passive treatment like Presby. And again, it's just hard to sample. There's no operation and maintenance really, other than just a normal system on things like Presby or Geomad or the infiltrated chambers. So as you're looking at things, to me, if you're in a really sensitive area, and I'm not sure, Title V is 100 feet, is 50 feet to wetlands. So whether you want to consider the use of secondary treatment units when there's kind of a piling on of variances, maybe too close to wetlands, maybe there's wells nearby, too close to cellar walls. I always tell people the more variances you're requesting, the more the board's taking a look at what's happening on the site to make sure that we can put enough stuff in place because whatever you do on a repair particularly is better than what was there. But how can we get as close to that balance between how much somebody has to spend on a system and the public health the goals that we want to achieve? So whether the wetlands is that 100 foot is where you want to go, or whether you want to kind of frame it in a different way as far as other sensitive, combination of sensitive, or whether you want to say if you're using 2 foot to offset. But even that, if you're doing 2 foot to offset and you're in an area of town water and there's no wetlands nearby. So again, we want the kind of iterative process about, even a 2 foot offset may be better than what they had there. And if it's an area of town water, you're not worried about wells, maybe that's okay. Sometimes 2 foot offset, if you go any higher, particularly down around the lake, all of a sudden you've got retaining walls and fill all over the place. So again, not that those are necessarily Board of Health concerns, but if you build up around somebody's house and shed water into the lots around it, that becomes an issue. So again, I've tried to kick it around in my mind a way that you might have either a checklist or a tick list or some general process that you can say, hey, this is our thinking on this. And I'm still kind of thinking about how that might work. But again, to me, that if you're looking for treated effluent, I like the idea of having operation and maintenance and some sense of how those things are working. So those oxygenated tanks, essentially fast jet, singular, there's probably one or two more that I'm forgetting. Those actually do a little bit of treatment and give you a little bit of effluent on the outside.
Those are called oxygenated tanks.
Yeah, they blow air into it essentially, and kind of make sure that the wastewater has some air so that some treatment can be done in there.
And isn't there a way to test the Presby with that? Isn't there an inspection port that?
The inspection port's between two lengths of pipe, and in the perfect world, there's no standing water in the inspection port.
Right.
If there is, that's when you start to get concerns. Yeah, and there's inspection ports in leach fields and leaching trenches, and again, the idea is if you're seeing water there, that may be indicative of something else, and if it's high enough, it may be indicative that it's failing.
So maybe if we said something like, if the applicant's requesting more than three or more variances within 100 feet of the wetlands, and a 2 foot groundwater offset, then the board requires the use of an oxygenated treatment tank or something. Or
an active treatment system as opposed to the passive kinds of things. Yeah. And so my thought is if the more sensitive receptors you're at, now if you're asking for that 2 foot groundwater offset, that's where I start to think that, maybe it should be some active treatment going on before you discharge it into them.
I think that's the right decision. It's the right call. You are right, as always.
So
no, it's a tough call. It's sometimes that 2 foot offset, and particularly now with things like Geomat, that saves the day as far as surface runoff onto lawns. It makes a big difference. That's not the only consideration, right?
Mm-hmm.
I seem to recall some town folk feedback about there used to be some rules in the book that existed before 2012, 2010, something like that. And I was wondering if we could possibly dig through some of the history on this, because I think there were rules in place for this and then they got rescinded, and now we're looking at pulling them back, maybe just seeing what some of those rules were and trying to figure out if there's a good blend. I'm just looking at it as a history lesson, more or less. Mr. Chick.
I think I may have copies of like I think regs were changed in like 2009. I mean, 7, 9, 11, 13 or something like that. Those dates kind of stick out. I may have copies of all those, Kevin, if I can send them to you. And
That would be wonderful.
If you could send them over, we'll circulate them.
Yep.
Okay. All right, so I think that maybe what I'll do over the next couple days is put together some language, just like one sentence, that might be a good fit for this regulation and include it in the next agenda. And then we can continue to discuss this at a public hearing on June 8th, if that makes sense to you guys. But I think we got some good information from Jim and some good guidance in regards to, how to treat these situations, knowing that everyone's a little bit different and, there's no hard and fast rule, but to achieve the desired outcome, we can phrase it in a way that, if the applicant's requesting more than 3 variances, et cetera. So maybe that's the way to go. So I'll make a motion to continue this public hearing to June 8th.
I'll second the motion.
Roll call vote. Kevin Davis,
Yes.
Dan Kane,
Dan Kane, yes.
and Kevin Baker votes yes. Running a little late, our public hearing 8:15 on the memorandum of understanding for public health coordinator. I did get a phone call today from the town manager, town administrator, and he let me know that the select board agreed to grade the position as an 11. I did not know this until he told me this. It was at a 10 before. Select board agreed to 11. In our paperwork, we're looking for a 12. He made it clear that 12 would be is improbable. So, I hate to do anything on this without Matt Wason being here. But I wanted to let you both know that, and also see if you had a chance to read through the MOU. And I know you may not have, being that the packet was uploaded so late. But any questions or comments, welcome at this time. Dan Kane? Yeah.
I read through it. I've not compared it to our previous version. I'm not sure if I don't see any notes of changes or modifications from our previous version. I know one of our questions was section 5. So it's it can be effective for 2 years, renew every year, and terminated with a piece of what happens if either party may terminate within 14 days. What happens on day 15 for administrative support and oversight for this position if either side, either the select board or the town manager or town administrator's office, or the board of health for some reason chooses to terminate this memorandum, then what happens to this position as far as operations and reporting and those kind of day-to-day pieces. I guess that was a question we had before. I think we had asked, and I don't think we heard back of what happens on day 15 if this agreement is terminated. Just to make sure that whoever is in this position is able to be successful, supported, and fulfill the functions of their position. If for some reason, I can't imagine that it would be ever, certainly without, plenty of planning ahead, but with that language there, I just want to make sure that we have that safety net of, okay, well then what happens on day 15 or what happens on, day 366 if it's not renewed in either in a timely manner or at all, of what that process is. And I'm just not sure where that would, if that falls into this, if that falls under other town personnel bylaws. I simply don't know.
Well, I think that town council had stated they'd seen it done a number of ways, not all of which are successful. But in the event the agreement terminates, it would most likely involve the board designating the chair or another member to act as day-to-day supervisor for purposes of approving vacation days and periodic check-ins, etc. And the town administrator would, still provide input into the performance review process. But that's sort of where we had left it.
Okay.
So
that's cool. I hadn't heard that feedback, so I just want to make sure that we have a plan and that it's everybody agrees it and understands that is the plan. So if something does occur, that we're all on the same page. The administrator's office, the select board, personnel board, HR, and ourselves are all on the same page of what that next step is until either it's renewed or some other process is constructed.
Kevin Davis, any comments?
I reviewed parts of the document because it was, in the packet and stuff. And I am a little concerned about the MOU. It doesn't seem to be strong enough. At least, what each party's responsibility is. I think we might want to look at strengthening some of the language in there to say what each party is responsible for and things like that. But that's just me getting educated on it. I've looked at other MOUs. I've been party to creating MOUs in other spaces, and those are usually much stronger and at least create the red line where the responsibilities end and the other responsibilities begin. So that's my comment about this.
Maybe I can get town council to join us on our next meeting so we can try and just alleviate any concerns and make any edits or additions that need to be made so we can move this thing forward. I know it's been a long time and everybody sort of wants to get the ball rolling on. So I will make a motion to continue. Any comments on the job grading?
So actually, why were we going after a 12? Because of the position amongst all the rest of them, so they reported at the same levels, or was that just for pay scale?
It was more about just making the grade equivalent to the responsibilities and the accountability of this individual, along with the have this person having the ability to make decisions and almost supervise themselves, so to speak, on a day-to-day.
Yeah,
that was the main, I think, reason.
Yeah, so that would be my concern as well, because if there's a grade, so we're saying that if there's a grade 12, this person's going to report into that grade 12. Is that what it's saying?
Yeah, I believe it. Yeah, so if you're a grade 11, you report to the grade above you, I believe. Actually, Ed Mullen has his hand up. He may be able to answer that question. There he is.
Thank you, Mr. Chair. I just want to go back to, I think it was a select board meeting, maybe 2 or 3 back. The Littleton Personnel Advisory Committee took the job description under advisement and they graded it in so it's a 3-member advisory committee, and 2 of the members took the job description and graded it as a 10. The 3rd member graded it as an 11. I went to the select board meeting when they were reviewing it, as did one of the PAC members and Michelle Vibert, the HR director. Ms. Vibert and myself got up and advocated very strongly for the grade 11 position. The PAC member was there and kept pushing for the grade 10 and saying that they didn't see how it could meet that. So in the debate and in the discussion, we were able to get the board of selectmen, the select board to vote it for an 11. And in my discussions with the town administrator and the implementation of the land use and buildings department, we, and when I say we, I mean the land use department, fully expect this individual, the public health coordinator, to be reviewed by the town administrator, to have ultimate supervision by the town administrator. And in the implementation, maybe in the beginning, have, feedback from both, the director of land use, which would be myself, in conjunction with the town administrator. Nobody's looking to have a direct report. I think that, when we're still creating the director of land use job description, that actually hasn't, I hold the title, but I don't have an actual job description. I'm actually just the building commissioner, zoning enforcement officer. We're just trying to streamline that process and share all our resources. So as it goes forward, we have a great working relationship with Jim, in his position, and we just wish we could have him more, and we fully want to support your board. We anticipate that the public health coordinator will, take direction from your board, just like Maren takes direction from the planning board, just like I work closely with the zoning board of appeals. Park and rec director works closely with her park commission. So we all have our boards we answer to, and we know that that's ultimately our first boss. And we have a pyramid effect. Everything funnels up to the town administrator. But if I can do any of the heavy lifting for Anthony as a town administrator, just to take some of the day-to-day away, and we fully anticipate the public health coordinator to work independently and efficiently with the supervision of you guys, the town administrator, and any help we can provide is what we're looking for.
Thank you.
That makes me feel better. Thank you, Ed.
Yeah, thanks. I think we're all kind of on that same page that, it's, well, maybe a very tiny department, even a department of one. It really is still a department head with its unique skill set and responsibilities that, while there's certainly some overlap for a lot of things, it is a unique skill set and department. And I think that's kind of where we're going for 11. It sounds like that's kind of where you were as well, that it's department head, even if it's a department head of one, and looking at the other things that fall on that grade 10 versus grade 11 titles here in town, that as a department head, it kind of is closer to an 11 as well. So yeah, I think we're all on the same page as kind of where it falls organizationally. And I definitely, of course, see, because there's so much of Title V and, use inspections and hoarding and all those pieces that kind of go across zoning and inspections and, emergency management as public health. Those circles cross in a lot of places, and there's plenty of places where they don't. So I love hearing that, it's a team effort and we're all bringing what we have and what we know to the table to be successful. So this is good to hear.
And if I may follow up, Mr. Chair.
Yeah.
So it would actually be a department of 1.25 or 1.5, because we'll have a public health nurse also. And, as soon as we can get the MOAs agreed upon and signed, we can post these positions. So we're anxious because we want to get it, in-house. And while we have Neshoba Associated Boards of Health on board for another year, that's a lot of, great cross training that can occur. We also anticipate a lot of coordination with Elder and Human Services and COA, where Elder and Human Services is actually taken on the mental health budget, which will still run through the public health nurse. So there's all this coordination that's occurring in town hall where all these departments are going to intersect and participate together. And just to give you guys an idea of some of the things that have been going on, there's been an email circulated between, started by Liz Tresniak over at EAHS COA with police chief, fire chief, and myself. And I have to give Jim a lot of credit here. We've been working with some families that have, fallen upon some difficult times, and they have some difficult housing situations, and they've had to be displaced. And in that, because of housing conditions and building code violations, it was first noticed by either police or fire. We've gone out, we've met with the families, but we coordinated with Jim and with Elder and Human Services to provide them with temporary housing so that they weren't immediately put on the street. And I can tell you, Jim always says, my first goal is to not make anybody homeless. He's very good at it. He's very compassionate. And it's none of our goal. Our goal is to try to provide safe housing for people that are in difficult situations. So we are coordinating together. It's a great team at Town Hall, and we're looking to build on it. And by no means is, anyone trying to supersede anybody else's authority. We appreciate, respect, and work together with the authority granted to us by the boards that we serve. So thank you for your time.
Thank you. We appreciate that. And thanks for all your hard work. And you guys do a great job. So I'll make a motion to continue this June 8th when we have Matt Wason, Gino, hopefully town council. We can button up those few last points and ship it off to the select board to get signed off on and get things rolling. Second.
I'll second it.
I'll second the motion.
All right, we'll call a vote. Kevin Davis.
Yes.
Dan Kane.
Dan Kane, yes.
And Kevin Baker votes yes. Administrative matters, the minutes, we'll take a look at the April 27th and maybe May 11th minutes, maybe not May 11th minutes at the June 8th meeting. We'll see what Elder and Human Services can post for a job description for a note taker, but it sounds like I'll be making a trip to Town Hall to meet with Commissioner Mullen about the potential new hire. I'll report back to the board on that. I'll see if I can get a copy of resume, some work history, and potential references, and we can discuss how to move forward if there's anything different that we want to do. Other administrative matters. My apologies on the tardiness of the packet. I'll do my best to collect all the information and store it in one place that can be easily accessed, and then call upon some computer savvy folks to help put it together and get it up and out. Correspondence, we had that correspondence from Alex McCurdy. We'll get a copy of that shelter plan from Jim, maybe.
Yep.
And I'll communicate to Mr. McCurdy that we'll review the plan and maybe have him in at a future meeting, depending on how fast he wants to act on updating the plan. Any other board member comments, updates? No? Dan?
I'll just be honest. I have not taken notes. I'm hoping Kevin did as our new clerk. Awesome. Thank you. And again, I apologize. I don't have the minutes for the 11th, but I should hopefully have them for everybody by tomorrow.
Thank you. Jim, any final comments, questions, anything?
At this point, I don't.
All right. Well, I'll shoot off a few emails after we get off here, and we'll keep the ball rolling on a bunch of different things we're dealing with. Thank you, everyone, for your time. Have a safe Memorial Day weekend, but we'll be talking, or at least emailing, before then. So if there's nothing else, we'll entertain a motion to adjourn. Oh, we have
See a hand up in the audience.
Let me see if I can promote. Oh, there we go.
Hi there. I don't know if I missed the opportunity for public comment or if it was just
No,
assumed
go ahead.
somebody raised
Just
their
state
hand.
your name and address, please.
Sure. Margot Bloomstein. I live at 7 Wilson Lane. And I wanted to first say I'm grateful so much for the perspective, wisdom, and rigor that you all bring to this, because I know it demands a lot, and I appreciate hearing that so clearly on calls like this, in meetings like this. I had, I guess, a couple points and questions. Dan, you raised how, kind of echoing so much of what we heard, the need to mitigate the spread, but you said, but if we can't police it and make it effective, does that mitigation, does a mask mandate really matter? And I just wanted to say, to use your example, we post speed limits, but we don't post traffic police everywhere, but still the majority of people comply because we set a standard. And I think that matters. I want to see us set that standard, because I remember joining in with a previous Board of Health meeting where we discussed lifting the mask mandate. And you said, okay, we would be setting triggers to say, if we hit these numbers, we're going to have to reimpose it. That sounded like it was the goal and the plan at the time, but we clearly haven't set those numbers. So I guess I'm wondering, can we get back to that? Because if the school committee is kind of not getting involved, it seems bigger than the schools, especially because right now, yeah, we only have a couple weeks of school left, but Littleton Parks and Rec, a lot of their programs meet in the school spaces. I was looking at some of their programs today and thinking, can I put my kid into that? Okay, hopefully she'll have a booster shot by then, but what about kids that are younger than 5? Are they all unmasked? What's that going to be like? And that's scary stuff. And I think that we need to take that into account.
Absolutely. Thank you.
Thanks.
Was there another comment, or is that no. Margaret, are you still there?
Oh, no, that was all I had. Sorry. Those were all my points, trying to get them in 2 minutes. Thank you.
Thank you. All right. Well, if there's nothing else and no other hands in the audience, we'll entertain a motion to adjourn.
I'll make a motion that we adjourn.
And I will second that motion. Roll call vote. Kevin Davis.
Kevin Davis, yes.
Dan Kane.
Dan Kane, yes.
And Kevin Baker votes yes. Thank you very much, gentlemen. Have a good night. We'll talk really soon.
Good night.